Welcome to Scienceland. This week, we will focus on a very interesting topic, diabetes technologies. Let's discuss how science is accelerating in the artificial pancreas. My guest is from Colorado University Assistant Professor Kaan Aktürk. He explained diabetes technologies, artificial pancreas, methods to increase the quality of life of patients with diabetes. Let's hear what he has to say. What are the diabetes technologies that improve glycemic control?
Artificial pancreas systems have two components. The first component is the continuous glucose monitor. The second one is the smart insulin pump. Continuous glucose monitors are called CGMs. These are the devices that are worn on skin or underneath the skin and measures the interstitial fluid glucose every 5 minutes and directly transfer this data to a smart insulin pump or patient's smart phone. And the other component or the artificial pancreas system is the smart insulin pump. A smart insulin pump gets the feedback from a CGM and increases the insulin if patient's glucose is going up and decreases the insulin or completely shuts off the insulin delivery if patient's glucose is going down. That's a great system to keep the glucose in range, decrease hypoglycemia, and decrease the hyperglycemic ranges.
Are diabetes technologies improving quality of life of people with type 1 diabetes?
Diabetes technologies improve the quality of life with people with diabetes, especially type 1 diabetes. Previously, the people with type 1 diabetes has to correct their glucose for hypoglycemia, and they were having severe hypoglycemia in the times that they were not monitoring with a CGM system. With the CGM systems, the hypoglycemia is almost a history right now. With CGM systems, there are prediction systems, there are notifications in the CGM systems, and most of them are connected to smart insulin pumps right now. So their insulin will be shut off or will be decreased in prediction of an hypoglycemia event. So diabetes technologies significantly decrease the risk of hypoglycemia in people with type 1 diabetes. That is a big advantage, especially for the diabetes in people with diabetes, in children especially with diabetes. Actually, the caregivers can monitor their glucose remotely, and they can be notified if their blood sugars are going down. And especially with the new systems that has a system of that auto shutoffs of the insulin delivery systems, and it gives parents and the caregivers the reassurance, and it increases the quality of sleep also. Other aspect of the diabetes technologies improve the exercise tolerance, and patients with diabetes can exercise more and more confidently. They can participate in longer exercise and more harder exercise regimes. And diabetes technologies significantly improved the glycemic control and quality of life in people with diabetes.
Systems can we expect soon in diabetes technologies?
There are a lot of developments are coming up in the CGM, smart insulin pump, and smart insulin pump systems. And one of the biggest developments will be in 2021 is the Dexcom G7. Dexcom G7 is significantly smaller than Dexcom G6 and no finger stick calibration. It's factory calibrated and it will be more environmental friendly with a smaller inserter, and it will be a little bit more accurate, and it will be still will be accepted in the ICGM category, which is a higher standard for FDA approval. And Dexcom G7 will be a really good system that has a potential to connect to other insulin pumps in the future. Another development is in the smart insulin pens. We have currently in pen in United States. That's the smart insulin pen system that can be used with any short-acting insulin. And this pen needs to be changed once a year, and it connects directly to patient's smartphone, and it adjusts the bolus insulin delivery system based on the carbohydrate amount, and it recommends the patients that how much insulin should be taken based on the active insulin time, when was the last time insulin was taken, and what is the expectations of the patient's glycemic control. The other recent development in this area is the Bigfoot, and Bigfoot had a recent FDA approval. And Bigfoot is an insulin cap system, insulin pen cap, and it also helps the patients to use an insulin pen like an insulin pump, and it helps the patients to give the correct amount of bolus and to achieve an optimal postprandial glycemic control. The other development is in the insulin pump systems. We have Omnipod 5, which is the only patch insulin pump system, will be the hybrid closed loop, is coming in summer 2021. And Omnipod 5 system will be the only system will be considering the trends in the CGM systems to give bolus recommendations. And Omnipod 5 has a system that has low suspension and also increases the insulin if patient's glucose is going high. Another system we expect to be available soon is the Eyelet. Eyelet is a smart insulin pump, works with the patient's weight, and it eliminates the necessity of carbohydrate counting. And based on the patient's weight, patients put the expected amount of food, usual, more than usual, or less than usual, and the system will be delivering the bolus insulin accordingly. Currently, it's in development with only insulin, but in the future, this system will be for insulin and glucagon bihormonal. So it will be the only bihormonal system in the upcoming years. So these recent developments in diabetes technologies are exciting, and I'm hoping that people with diabetes live life without any fear of hypoglycemia, and they can fully enjoy the life without the consideration of fear of hypoglycemia and the hassles of diabetes.
Thank you, Kaan. Today we have opened the doors of diabetes technologies and learned a lot about artificial pancreas. I hope to talk to you soon on further developments.
Thank you.